Hey freedom lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. As more and more evidence of the serious adverse events and dangers inherent in COVID-19 mRNA shots are coming to light, states are considering banning them as well as other potential mRNA injections. Washington, Idaho, Montana, Iowa, Texas, Florida, Kentucky, Tennessee, and South Carolina have already proposed such a ban for injections for people, arguing that the risks of these vaccines outweigh any theoretical benefits. Epidemiologist Nicholas Hulscher, along with Mary T. Bowden and Peter McCullough, co-authored a peer-reviewed paper in the journal Science, Public Health Policy and the Law calling for the market removal. The paper's abstract states that worldwide COVID-19 vaccination campaigns have failed to meet standards for safety and effectiveness, with increasing evidence of significant harm, including deaths that, quote, have far exceeded the recall limits of past vaccine withdrawals. As of September 6, 2024, the CDC has documented 19,028 deaths in the United States reported to VAERS by healthcare professionals or pharmaceutical companies who believe the product is related to the death. The total number of COVID-19 vaccine deaths reported to VAERS, 37,544 among all participating countries, have far exceeded the recall limits of past vaccine withdrawals by up to, get this, 375,340%. The criteria for an FDA Class 1 recall, which applies to products with a reasonable probability of causing serious adverse health consequences or death, have been far exceeded. Excess mortality, negative efficacy, widespread DNA contamination, and a lack of demonstrated reduction in transmission, hospitalization, or mortality have undermined the rationale for continued administration, end quote. On February 16th of 2023, Phoebe Liu reported for the Daily Clout on the dramatic disparity between the 25 deaths from the swine flu vaccine in 1976, which triggered a recall of the vaccine, versus the 32,740 deaths seen at the time from the COVID-19 injections without any thought of a recall. The CDC's failure to address the high death toll, which had have prompted a vaccine recall, was made even more egregious by its decision to include the shot in the immunization schedule for adults and infants as young as 6 months, just 6 days before Liu's analysis. Absolutely criminal. According to RFK Jr., quote, "This reckless action is the final proof of the cynicism, corruption, and capture of a once exemplary public health agency. ACIP members have demonstrated that fealty to their pharma overlords eclipses any residual concerns they may harbor for child welfare," end quote. With mounting evidence of serious risks, the continued use of mRNA injections, whether for people, livestock, or produce, is an urgent concern. Some states are moving to ban these shots, yet regulators keep approving and promoting them. Vaccines have been pulled for far less, so why does this one get a free pass? If they're safe, why are there calls to take them off the market? And if they aren't, why are officials still telling people to take them? Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.